licensed clinical social workers, licensed marriage and family therapists, or licensed professional counselors, PsyD, psychiatrists, any type of counselor or therapist can help people beat addiction by implementing evidence-based strategies. One of the most popular ones are motivational interviewing and the way that we speak to people to draw them in and to help them see the other side of things. Cognitive behavioral therapy is an evidence-based treatment that helps people with addiction and mental health. One of the things that we have to talk about with therapists, though, is that today's therapists tend to look at addicts and alcoholics as a victim rather than somebody who needs to take accountability and ownership. And that has largely in part contributed to lower success rates. So if a therapist or a counselor is able to help that person see how they put themselves in the position they're in, how to look at things unselfishly, how to look at their behaviors that are causing the problems, then that therapist can have a profound effect on the outcome. Where we see clinicians fail is when they try to become the person's friend, or if they co-sign their lies and deceit, or if they think they're doing great when they're not. Those therapists can actually compromise an outcome. So I know when we do interventions, we work with treatment centers where we know the staff. I'm not going to send your loved one to a lot of facilities because we've worked with some facilities where the therapists they don't get it on the levels that some other therapists get. And the biggest difference is what I just said. If that therapist is not willing to challenge, if that therapist is not willing to not be their friend, if that therapist is not willing to hold them accountable, then your loved one probably won't get as far as with a therapist that will do that. So a therapist can help your loved one work with their addiction. There's no such thing as beating an addiction, but to get them into recovery, to abstain from substances and bad behavior, that therapist needs to know how to help that person see what it is they did and to not look at the character defects of others.